May is Stroke Awareness Month, and Monday's passing of Hollywood director John Singleton is bringing special attention to the health issue that claimed his life. Maureen Mathews is a nurse practitioner at the Stroke Clinic, part of OSF's Illinois Neurological Institute, and she joins us now with insights on stroke awareness and prevention. Welcome to Living Well.
Thank you.
So I suppose we should start with a definition. What is a stroke?
So there's two kinds of strokes. There's ischemic, or a clot that blocks up a blood vessel, and then there's hemorrhagic strokes, which means a blood vessel breaks open and bleeds into the brain tissue.
And how does one get a stroke? How does one have a stroke?
Stroke is usually caused by risk factors. There's multiple. Blood pressure, high blood pressure is number one. High cholesterol, diabetes, smoking, inactivity, obesity, family history. There are some other factors, blood clotting problems that are a little lesser known about, but the high blood pressure, cholesterol, diabetes, smoking, those are the big ones.
So when Director John Singleton passed away this week, everyone said he's only 51. Does age have any implications when it comes to stroke?
Interestingly enough, it's usually age, the older we get, the more our risk increases. A 51-year-old you would never think would be having a stroke. We tend to think of stroke as an older person's disease. And we're seeing more and more younger people, and much of that is because of risk factors that are not well controlled or that people just don't know about yet because they're not taking care of their health quite as well as they should. Sometimes they have some underlying issues like the blood clotting that I mentioned. That might not be something that ever shows up until you're in your mid-adult years. Or a heart kind of issue like atrial fibrillation, which we're seeing in younger people also.
Are there any other demographics that might be more adversely affected, men versus women, different racial groups?
The stroke risk is higher in African American individuals. In women, higher as we age. Our risk increases with age. In men, it starts at a younger age. That's the basic that most generally we talk about. And
my guess, as with anything, if you can catch it early, your chances of surviving and thriving are better.
Correct, yes.
So how do we catch it? How do we know a stroke might be happening?
Yeah, well, we try to teach the public about the signs and symptoms and the risk factors. So the signs and symptoms are current is be fast. So a sudden onset of dizziness, sudden onset of vision change, loss of vision in one or both eyes, sudden droopy face on one side or the other, difficulty speaking or slurred speech, and then we ask people to try to pay attention to the time, because time is a very important factor when it comes to treatment.
So once somebody might be having these symptoms and you get them to the hospital or to some medical care, what happens then? Is there anything we should be doing on the front side of that? Any medications we might try to administer at home?
Absolutely none.
No.
A lot of people think that they should take an aspirin because that's what we teach the public about with regard to heart attacks. Take an aspirin. But when you have a stroke, we don't know if it's a bleeding stroke or a clot type of stroke. And if you took an aspirin and it was a bleeding stroke,
it could make it worse.
It could make it worse. And until we take a picture of your brain, we don't know which kind you're having. So we don't want you to take anything.
So healthy lifestyle on the front side and quick prevention or quick assessment and addressing the issue on the back.
Correct, correct.
Thank you very much for being with us here on Living Well. We appreciate your insights very much.
Thank you.